It's 2021 everybody, and this is Medicosis Perfectionalis helping students get their heads out of their collective sphincters since 2017. Let's continue our endocrinology playlist. In the previous video we started part 1, clinically oriented anatomy. Today is part 2 of the clinical anatomy of endocrine glands, and let's get started. We start by the hypothalamus, or your CEO, and then your pituitary, which is the general manager. After this, we have 3 glands that listen to the pituitary and 3 glands that could not care less about the freaking pituitary. The 3 that care are the thyroid, adrenal cortex, and gonads. How do they care? Through TSH, ACTH, FSH, and LH respectively. Parathyroid, pancreas, and adrenal medulla do not listen to the pituitary. There is no connection between the pancreas and the pituitary. So when woke people tell you, oh, aspartame in this artificial sweetener is gonna mess up with my insulin and glucagon and pancreas and is gonna trick my brain into eating more sugar, and at the end of the day, this artificial 0-calorie sweetener is gonna make me more obese. Nonsense. There is no connection between the pancreas and the brain whatsoever. You said to yourself, I only consumed 0 calories, therefore I deserve an ice cream now. It's not the aspartame's fault, it's your own freaking behavior. Enough with the projection and rationalization, because both are defense mechanisms, and as Gordon Ramsay might say to you, hey big boy, listen, take responsibility for your actions essentially. Now let's start by some enticing questions. What is the cheapest way to diagnose Graves' disease? What's the cheapest way to diagnose hypothyroidism, Cushing's syndrome, acromegaly?
Oh, that's easy, Medicosis. I can measure the TSH, T3, and T4, do thyroid scan, ultrasound, etc.
No, that's not the cheapest. I'm saying cheapest. Imagine that you are a very poor doctor in a very poor hospital. I'm talking destitute. I'm talking in the hospital you have stray dogs feeding off of the IV fluid and giving the patient rabies, kind of poor. So what's the answer? Here's the cheapest way, an old driver's license. And then you compare the patient's old driver's license with the patient's new driver's license to see the patient's photo. Here is George when he was young, and here is George right now. What do you think the diagnosis is? This is hyperthyroidism. I mean, look at the exophthalmos, look at the sweating, look at the silky hair, and look at the goiter, and he became thinner. He lost weight despite an increased appetite, and he probably has some diarrhea right now. Hypothyroidism, on the other hand, is going to be the opposite. George is going to gain more weight. George is going to be lethargic, tired, lazy, fatigued, depressed, etc., and constipated. So even if you are in a hospital with no resources whatsoever, I mean the only thing that you have is a sphygmomanometer and a freaking stethoscope, you can still diagnose some pretty difficult diseases if you have 2 brain cells that rub together. Hashtag synapse. Another cheap question. Here's another patient, totally different. Patient's chest x-ray came back showing a solitary pulmonary nodule, as you see here.
What's the next step? Oh, I should do a CT scan and biopsy it.
No, think cheap, doofus. Think cheap first. And the answer is, you compare today's chest x-ray with a previous chest x-ray. If the nodule is not changing, it's probably benign, forget it. But if it's growing bigger and bigger and bigger, this is something to worry about. Especially if the patient is a heavy smoker. Another cheap question. Here's a third patient. How can you diagnose diabetes insipidus before even taking the patient's history? Now this is a medicosis level of expertise. And here is the deal. You'll find a patient holding a humongous bottle of water. They are drinking water like crazy. I mean, this is a 2-liter bottle, maybe 2 bottles. And when they ask the nurse for water, which they do all the time, they ask specifically for ice water. For some reason, ice gives you this kind of satisfaction, or it decreases your need to drink lots of water, and we will tell you about great story when we talk about nephrology. In cases of patients who you're trying to restrict water, but not 100% restriction, you're trying to make them drink less, so only 2 cups of water per day.
But doctor, I'm so thirsty, this is torture.
A great solution is to give the patient ice. For some weird reason, ice makes the patient feel comfortable and makes the patient ask for less water, and everyone becomes happy.
But why is the patient drinking a humongous amount of water?
Because in diabetes insipidus, there is no ADH, or the kidney is not listening to the ADH. What is ADH? Anti-diuretic hormone. This hormone tries to keep the water in your body and prevent the water from ending up in your urine. But when you lack ADH, there is no anti-diuresis. Therefore, what should I do? What would I have? Diuresis? No kidding. And when I'm having diuresis and losing tons of fluid in my urine, what will I do to compensate? You will drink water. A lot of it. Please remember these stories because they will help you tremendously at the hospital. You might be the only one in the freaking hospital who can diagnose this really quickly. Here is a very difficult case for you, but please remember this. Here is a patient always complaining of abdominal pain, always. The surgeons have opened her multiple times and they find nothing every time. It's not acute abdomen, and she's always complaining of pain. And now she's going crazy and she requires psychiatric counseling. Now, what's the diagnosis? Because this can save the patient tons of agony. The answer is probably acute intermittent porphyria. I know you're watching and rolling your eyes, but 10 years from now, some of you doofuses gonna send me an email. Oh, actually, medicosis, I was able to diagnose porphyria based on your crazy story, and I saved the patient's life. Wonderful. And now, diabetes insipidus versus diabetes mellitus. The name has the answer. The word insipidus means insipid in English, which is tasteless. But mellitus means sweet. Oh, so diabetes insipidus literally means tasteless urine. Diabetes mellitus, sweet urine. Wow, this is kind of weird and creepy, medicosis. Yeah, because you are a young snowflake living in the 21st century. Back in the day, doctors used to drink and taste the urine in order to make the diagnosis before urinalysis and urine tests became robust. Diabetes insipidus, the urine is so dilute with low specific gravity. In diabetes mellitus, it is so sweet, it's concentrated with tons of glucose. Now here are some words of wisdom. The ligand alone is not active. The receptor on its own is not active, but the ligand-receptor complex is active. That's why there are many a disease in medicine that you either have a problem in the ligand or a problem in the freaking receptor. Moreover, when the problem is in the ligand, we call it type 1. When the problem is in the receptor, we call it type 2. Case in point, what is type 1 diabetes mellitus? Type 1 is when you have no insulin. You have a problem in the ligand. But what is type 2 diabetes? Your insulin is fine, but the receptor is resistant. It's not responding to the insulin. It's called insulin resistance or insulin insensitivity. Consider diabetes insipidus. Okay, what is type 1 diabetes insipidus? This is the central diabetes insipidus. You have no ADH hormone. How about type 2? ADH is fine. It's just the kidney receptor is not listening to the ADH. And that's it. Medicine makes so much sense once you understand what the flip you're talking about. Next, let's talk about your great general manager, the pituitary gland lying in the beautiful sella turcica, which literally means the Turkish saddle. Turkish like as opposed to what? The Egyptian saddle? How is that different? Can some historian please let me know in the comment section why did they call it the sella turcica? Because I want to rename it the sella egyptica or the sella croatica. I really don't get it, and as Robinson Crusoe might say, I don't like it at all. Now let's turn our attention to pituitary adenoma and the visual pathway. What is adenoma? Oma means it's a tumor. Since there is no adenocarcinoma here, it's just an adenoma, I know it's a benign tumor of the pituitary gland. It's a freaking mess. Okay, let's talk about visual pathway. Here is your left eye, and here is your right eye, and that's your visual field. Wonderful. Okay, how do I see? Your visual field is divided into a temporal side and a nasal side. Nasal is closer to your nose. Temporal is close to your temple. The temple here refers to the temporal bone, not a place of worship. Since light travels in straight lines, the temporal visual field will be shining onto the nasal retina, and vice versa. The nasal visual field will be shining its rays into the temporal retina. Temporal retina is connected to the temporal fibers in the optic nerve. This is the optic nerve, and then the optic chiasm. After this, you have the optic tract. But here is the deal. Only the nasal fibers, those close to your nose, cross through the midline into the opposite side, but the temporal fibers continue straight ahead. So tell me again, what crossed are the nasal fibers, and therefore the temporal visual fields, because the temporal visual fields are carried by and represented by the nasal fibers. Now, who is here in the middle? Who is lying comfortably on the glorious, magnificent Ottoman Turkish saddle? That's a terrible joke, I'm sorry. It's the pituitary gland, and when you have a pituitary adenoma, the pituitary gland increases in size. When it increases in size, it presses on the optic chiasm. When you press on the optic chiasm, you have eliminated your nasal fibers and temporal fields. Now you cannot see temporal fields, so you will get a tunnel vision. You're only able to see your nasal fields. That's a tunnel vision. But temporal peripheral fields are invisible to you. What do you call this condition? It's bi, because it's bilateral. Temporal, because you have lost the temples. Hemi, half. Anopia, an means no, and opia means vision. So I cannot see bitemporally.
Okay, this pituitary gland is getting out of hand. It is so big. It has an adenoma and it's causing symptoms. What should we do? Remove it. How do I remove it? It's a surgery. Like, will you open my skull and open my brain and get a new...
Oh, don't be a drama queen. It's just one needle. Comes and pierces through the greater wing of your sphenoid bone, and then it will go deep inside, reach the pituitary, and suck the mass out. We call this transsphenoidal surgery. That's an exam question. Did anyone notice that the pituitary look like a testy? And here is a pair of testes in a hairy sac. These are the gonads. Therefore, you have a gonadal artery and a gonadal vein. The gonadal vein is the same as testicular vein in males and ovarian vein in females. Let's talk about males. The left gonadal vein drains into the left renal vein, but the right gonadal vein or right testicular vein will drain directly into the inferior vena cava.
How do you remember it, medicosis?
I just remember that the left vein is long. It's long, so it has a space to drain the testy. It also has enough space to drain the left adrenal vein. Same thing here. Left adrenal vein drains into the left renal vein, but right adrenal vein drains directly into the IVC. Now, this fact above here does not have any clinical significance. I mean, when was the last time you've noticed that your left adrenal gland is congested? Never. But if I have varicocele in my left testy, you can bet the rent money I will notice. It's a bag of worms.
So why do I care?
Imagine that I have a thrombus in my left renal vein. Okay, do you think the left testy will be able to drain? Oh, let's see. We go up, 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 up. We're trying to go to the heart. Oh, I cannot. So blood will accumulate until this area becomes swollen, and the doctor will feel it as a bag of worms. It's called the pampiniform plexus of veins, because everything is congested. But the right testy, on the other hand, drains directly into the IVC. It will not be bothered, even if I have a thrombus in my right renal vein. Now let's talk about your anterior pituitary one more time. Here is your thalamus, and here is your thalamus. Here is your hypothalamus. The word thalamus literally means the cradle or the baby's bed, and therefore the hypothalamus is under the bed. By the way, you have two thalami, right and left, but only one hypothalamus. If you did not know this, there is no hope for you. I'll take it back. There is always hope. There's just no chance. Let me tell you about the growth hormone. It comes from the anterior pituitary. How about the prolactin from the anterior pituitary? TSH, anterior pituitary. ACTH, anterior pituitary. FSH, anterior pituitary. LH, anterior pituitary. ADH and oxytocin, hypothalamus. Like what the F? Have you ever wondered why ADH and oxytocin came from the hypothalamus and not from the anterior pituitary? I mean, everything else came from the anterior pituitary. Why not these two? To understand the profundity behind this, please remember the limbic system. It has many components. Here are the most famous ones. The amygdala for emotions, mammillary bodies and hippocampus for memory, and the anterior hypothalamus for secretions. And what the flip does that have to do with ADH and oxytocin? ADH and oxytocin were secreted from the hypothalamus, and they are related to memory. If they are related to memory, they have to come from the hypothalamus because it's part of the limbic system and the limbic system is responsible for memory. Oh, really? Yes. What's the function of ADH, big boy? Here is one word. Blood pressure. These are two words, but I'm sorry. ADH has two receptors, V1 and V2. Both of them are trying to do one thing in life, to maintain a robust blood pressure and to prevent hypotension. V1 will constrict your blood vessels to maintain the blood pressure. V2 will tell the kidney to retain all the water to increase the volume inside your vessels and increase your blood pressure. So let's say that you were texting, distracted, wearing the new Apple headphones and not listening to traffic, and you got hit by a car. Do you want to remember this in the future? Oh, of course I want to remember this so that I learn from my mistake and not repeat it. Wonderful. That's why ADH comes from the hypothalamus, and the hypothalamus is part of the limbic system, which is for memory. You want to remember this. This should not come from the freaking anterior pituitary because it's not part of the limbic system, you doofus. Now, how about oxytocin? Oxytocin has everything to do with memory, but in the opposite direction. Oxytocin makes mommy forget all about the pain of childbirth so that she can forget it and be pregnant again. There is something in epidemiology or population statistics known as the population replacement rate, which is about 2.1 children per woman. Okay, what's the population of Egypt, for example? I don't know because the government sucks, but let me give you an estimate. It's about 100 million people. Okay, in order for Egypt to maintain its population at 100 million without any increase or decrease, every Egyptian woman should give birth to 2.1 children.
But how would she give birth to 2.1? Where do you get the 0.1?
No, it's a statistical average, you doofus. It's like the old joke, the typical American family has 2.5 kids and 1.4 dogs. Anyway, every woman has to give birth to 2.1 in order to maintain the number of the people in a population. Therefore, I don't know where you went to school, but 2.1 is greater than 1. Oh yes, if mommy said this pain was so horrible I'm not gonna be pregnant again, we will not be here. But once mommy gives birth, oxytocin kicks in. Oxytocin is the same hormone that pushes the baby out. If you remember, this is pitocin that we give mommy if the pregnancy is not going through and we want mommy to contract more. The doctor will give her pitocin, which is the artificial oxytocin. This same oxytocin will make mommy love her baby and she will forget everything about the pain, so that humanity may survive. When I was young, my mother used to tell me, one of the most fascinating things in life, my son, is a lady, once she became pregnant and gave birth to her first child, the lady is changed forever. She no longer cares about herself, and she no longer thinks that the universe is revolving around her. From now on, it's all about her baby. I thought that my mother was kidding, until I started reading about oxytocin 15 years later, and my mother was right. If I would just shut up and listen to my mom, my life would have been so much better. Okay, 2 thalami, 1 hypothalamus, 1 pituitary. We have anterior pituitary and posterior pituitary. Between the hypothalamus and the anterior pituitary, there is hypophyseal portal circulation. What's the hypothalamus? What's the hypophyseal? It's the pituitary. Pituitary is the hypophysis cerebri. Cerebri means the brain. Hypophysis, hypo means below. Physis means growth. It's a growth below the brain. Yes, indeed. So the connection between the hypothalamus and the anterior pituitary is a blood connection. Translation: the hypothalamus will secrete CRH, for example, that's a hormone, will get secreted into this blood, into this portal circulation, and the CRH will go and reach the anterior pituitary. Hey anterior pituitary, I am CRH. Would you please secrete some ACTH? Sure, I'll secrete some ACTH, and ACTH will go to your adrenal cortex, and so on and so forth. That's a blood connection. But the connection between the hypothalamus and the posterior is a neuronal connection. It's a tract. What's a tract? If you remember the definition of a tract, it is a collection of axons in the central nervous system. A collection of axons in the central nervous system is a tract. This tract happened to be between the hypothalamus and the hypophysis, which is the pituitary. So we call the hypothalamo-hypophyseal not circulation, but tract. That's a neuronal connection. And that's why the pituitary is not a gland. It does not secrete anything. All of its secretion were made in the maestro, in the CEO, in the hypothalamus. Example, oxytocin and ADH. ADH will leave the hypothalamus here and reach the pituitary here. The pituitary will just store it and then release it into the blood, dump it into the bloodstream. But it's not an actual gland because it does not produce anything. And that's why the anterior pituitary is a gland. It's called an adenohypophysis. But the pituitary did not secrete squat. It does not deserve the name adeno. We'll just call it neurohypophysis, referring to that neuronal connection. Medicine makes so much sense once you understand what the flip you're talking about.
Why do you call it hypothalamo-hypophyseal portal circulation? What's a portal circulation?
La porte in French is the door.
What does that mean?
Imagine the portal circulation of the liver.
The circulation was going like this. Oh, vein, vein, vein. Let's go to the right atrium back in the heart. Okay, wonderful.
Or you can open a door for us, la porta, and we can go to the liver and then come back. Why do you do this? Because the liver is very important. That's a door, that's a back door that you have opened. That's why it's a portal circulation. Similar story here. The blood was just going down, but why wouldn't you shunt here because the hypothalamo-hypophyseal portal circulation is important and then go back? Oh, that's an idea. Next, the pineal gland or the epiphysis cerebri. Pineal literally means a cone-like gland. And this is the epiphysis cerebri, but the pituitary was the hypophysis cerebri. The legend has it that when the great Greek physician Hippocrates was training his younger cousin Galen, he told Galen, "Hey Galen, okay, I want to teach you about neurosurgery. Come here and help me."
Okay, sure. Should I mess with the hypophysis cerebri?
Shut up, Galen. You can go tamper with the epiphysis cerebri. A growth above the brain. This is above because the pineal gland, but look at the pituitary is the hypophyseal there. Hypo, epi.
Who supplies the pineal gland?
It has some sympathetic nervous stimulation through the superior cervical ganglion and parasympathetic from the sphenopalatine ganglion and the otic ganglion.
But why does a gland need sympathetic and parasympathetic?
Remember, what was the effect of sympathetic on blood vessels? Usually vasoconstriction. What was the effect of parasympathetic on blood vessels? Usually vasodilation.
Okay, why will a gland need this?
Because the gland secretes, right? Yeah, any gland will secrete some stuff. The pineal gland secretes melatonin. In order to secrete, where do you think we get the secretions from? Where do you get your sweat from? From the blood. Where do you get your urine from? From the blood. Where do you get your earwax from? From the blood. Where do you get your lymph, endolymph, perilymph from? From the blood. Where do you get your precious crocodile tears from? From the blood. Where do we get the melatonin from? From the blood. We get the blood, we modify it, we add some stuff, we subtract some stuff, and we give you some doozy hormone. So everything came from the blood. If you want me to secrete more, please dilate the vessel that will supply the gland. If you want me to secrete less, please constrict the vessel that will supply the gland. In other words, parasympathetic will increase the secretion of melatonin, sympathetic might decrease it. Which makes perfect sense if you understand that the secretion of melatonin is boosted at night but decreases in the morning. And of course, when you're sleeping, it's the parasympathetic gland. It's rest and digest. And when you're sleeping, you're resting. When you're resting, you'll vasodilate. When you're vasodilating, more blood will go to the pineal gland, more melatonin will be secreted, so that you might have a lovely night. Now, pinealoma. Pinealoma is an oma. It's a tumor in the pineal gland. It can grow, and compress other structures, such as the RIMLF. This is the rostral, whatever, interstitial, medial, longinal, fasciculus of the midbrain. Okay, what's the function of this? Vertical gaze. So when I compress it, I will have vertical gaze palsy. I will no longer be able to look up or look down. I will only be able to look side to side. What else? It will also compress the cerebral aqueduct of Sylvius because it's also in the midbrain, and I will have hydrocephalus. Side note, what is the difference among pineal, pineal, and penile? Pineal is the cone-like gland, your epiphysis cerebri. Pineal related to the penis. Penile, let me tell you a story. When I first came to America, I saw a lawyer running an ad called Penal Law. I said, penal what? Like, is he talking about a penis? Do you need a lawyer for this? How bad is it right here?
Your Honor, my client's copulatory organ was not fully erect, ergo he's not liable.
You know the saying, the hand of the law can reach above and beyond. Except in this case, it has reached below and underneath. They say that attorneys can reach every crevice. And then later, I googled it and it's penal from penalty. It's penalty law, has nothing to do with the PP, but because I went to medical school and I studied too much, I just lost it. Thank God I did not call that lawyer. And don't forget the cerebral aqueduct of Sylvis is here. It's between the third ventricle and the fourth ventricle. It's in the midbrain. And that's why when the pinealoma compresses it, what's gonna happen? Your cerebrospinal fluid is gonna accumulate in the lateral ventricles and the third ventricle, and this is called hydrocephalus. Also, when you have a tumor here, it's gonna compress the midbrain, leading to problems with the vertical gaze. What is this disease called? It is called Perinode syndrome. So pinealoma is the pathology. Perinode syndrome are the symptoms, the medicine, the clinical stuff caused by the pathology. And here are two cases for you. Case number 1. A 32-year-old man presents to your office complaining of excessive thirst. He drinks 7 liters of water every day. He works in a mining industry to produce batteries for the Tesla Motor Company. Not a sponsor. Physical exam is evident for tremors. His serum sodium is 160. TSH is elevated. What's the most likely diagnosis? If Elon Musk ended up watching this video, we're joking. Case number 2, a 19-year-old female comes in with a painless, mobile midline anterior neck mass, swelling below the hyoid bone. When you ask the patient to protrude her tongue, you found that the mass moved upwards. It's called a superior tug. When you asked the patient to swallow, you felt the mass moving upwards. What is the diagnosis? You'll find the answer to these questions in the next video. And we still have a 50% discount at medicosisperfectionalis.com. Use the promo code HAVE to get a discount towards anything on my website. You can also use that discount to get my cardiac pharmacology course, learn about the anti-hyperlipidemics, the anti-arrhythmics, anti-anginal medications, anti-hypertensive, diuretics, digoxin, etc. and be the best doctor that you can be. Happy 2021. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here, and you can go to my website to download my courses. Thank you for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.